All right, you ready, sir? Okay. All right, let's go in 3, 2.
Hello, everyone. It's Tuesday, May the 3rd, and regretfully, we've got 15 additional deaths. We've surely realized this thing is moving in our direction and moving in a good way, but at the same time, we've lost 15 more people. And these people are not numbers. These people are moms and dads and grandmas and grandfathers, and they are absolutely friends and comrades in every way. You know, please don't forget just how much wisdom and just how important these folks are, especially to all their loved ones. Please, if you know them, reach out. And if not, please keep them in your prayers. The 6,856th death is a 76-year-old female from Raleigh County. The 6,857th death is a 75-year-old female from Fayette County. The 6,858th death, an 89-year-old female from Harrison County. The 6,859th death, a 55-year-old male from Mingo County. The 6,860th death is a 67-year-old female from Logan County. The 6,861st death is an 86-year-old female from Calhoun County. The 6,862nd death is a 92-year-old female from Raleigh County. The 6,863rd death is an 87-year-old male from Lincoln County. The 6,864th death is a 74-year-old male from Wood County. The 6,865th death is a 98-year-old female from Kanawha County. The 6,866th death is a 64-year-old male from Kanawha County. The 6,867th death is a 77-year-old male from Wyoming County. The 6,868th death is an 82-year-old female from Raleigh County. The 6,869th death is a 71-year-old female from Fayette County. The 6,870th death is a 94-year-old female from Harrison County. 8 of these deaths were reconciliations. That means we lost 7 since the last time we were here, but nevertheless, it's tragic, and please keep them in your prayers. We have 812 active cases now in West Virginia, 225 new positive cases, 6.23 on our daily positivity rate. That's up some. We're 8.10 on our cumulative rate. The recovered cases are almost 495,000. We have 100 people that are hospitalized now, with 23 in the ICU unit and 14 that are on ventilators. 54 counties are green and 1 county is yellow. I've got to tell you this, and very regretfully, that we've lost a firefighter. On Sunday, a vehicle, drove into the Elk River, resulting in the death of both the vehicle occupants and an off-duty volunteer firefighter. These people always run to the fire. And losing this gentleman, John D. Forbush, he's 24 years old. It's a tragedy beyond belief. And so for all those involved in this terrible accident, and especially this hero of West Virginia, all of us mourn. And so please keep him and all of his family and all of his loved ones in your prayers. I've got some really, really good news to report, and I'm not good at good news. Really and truly, because I just kind of brush by and then try to find the next thing and the next thing and the next thing. This is a celebration that we should have in this state, that we absolutely ought to have 1,000 parades for. The state of West Virginia is really doing it, and that's all there is to it. I'm not going to be ashamed to celebrate the good, but it seems like we've had so much goodness here lately and everything that it's just one thing right after another. And almost we get even used to it or taking it for granted. But I want you to pay close attention to these numbers just for a second. When we came into office, really and truly, we were really upside down. And this state, for all practical purposes, was bankrupt beyond belief. You know, in the first year, I think we ran across the finish line with a $4 million, surplus, and we were so happy it was off the chart. And I could be wrong in these numbers, so don't hold me completely to these numbers. The next year, it was slightly better. Can you just imagine, along the way, we built the rainy day fund to over $1 billion in the state of West Virginia. Now the rainy day fund, we don't need to put more money in the rainy day fund, and it's stable and it will perpetually go forward for years and years, if not decades and decades to come. You know, it in itself is an incredible accomplishment. But now just think with me just about this. We are 10 months into this year. Our year end is June the 30th. We are 10 months down the road. You know, I think it took decades and decades and decades to build the rainy day fund. With that, we are 10 months into this year right now. We're doing so much stuff across this state, it's unbelievable, and it's all working. You know, I did promise you a rocket ship ride. Well, I'm telling you right now, the rocket ship ride is phenomenal and absolutely going so fast that we can't even comprehend it. But with all that being said, in 10 months, for the 1 month of April, and I'll get to the 10 months, for the 1 month of April of 2022, now can you imagine what a celebration that we would have had 5 years ago, 7 years ago, if we were able to have said, in the year, we're going to have a surplus that exceeds $200 million. Well, we would have absolutely gone crazy. We would have absolutely thought it is the greatest day in the history, or the greatest year that we could ever fathom. In 1 month, in April 2022, you know, in 1 month, we have a $253 million surplus. In 1 month. For the 10 months of the year, we are at $993 million of surplus. In essence, what we have really done is we have built, potentially, a rainy day 2 in 10 months. That's just how good we are doing in the state of West Virginia. Without any question whatsoever, more and more folks are coming. I met just a little while ago over at the mansion about a company that is going to be making batteries for pontoon boats and then to bass boats, and employing hundreds more people. Absolutely, without any question. I just got through being, awarding, the great people that work for the state of West Virginia, 30-year people that have worked 30 years and more, 40 years and more. One gentleman, 60 years and more, and still going. I absolutely awarded our Shining Star, awards to people that are in government that don't surely have that kind of time, but they are doing incredible work. At the end of the day, the great people that are working for this state and in totality, all of us together, we have absolutely put ourselves on a pathway that is off the chart. And it doesn't matter what anybody writes or what anybody says. I would say to any and everybody, rub it in their face. If they want to absolutely continue to be sticks in the mud and absolutely try to bog and pull us back down, don't pay attention. Move forward. $993 million surplus in 10 months. In 10 months. For the month of April, $253 million surplus above budget. Can you imagine all the good that we can do in the state of West Virginia just with what I'm talking about? Without any question, there's accolades that can be passed all around every direction known to man. I congratulate everyone. I thank everyone in our state. This is absolutely real. It's really going. We don't need to get in our own way, stub our own toes and everything else. We should be very, very proud. You talk about West Virginia being a diamond in the rough. I would say West Virginia not only is a diamond in the rough, but now we're the diamond in the rough And we're the pot of gold too. And the pot of gold is all of us that know how to love and appreciate and absolutely be just how great we are in this great state. Low crime, faith-based, community, love one another. That's us. That's us. And literally it's working. So congratulations, West Virginia, in every way. Now let me go back. Let me jump back to, the COVID stuff at hand and everything. I want to remind you over and over about getting your booster shot. It is so important. If you're out of your booster shot, a gentleman that I've done a lot of work with called me the other day and said, Governor, what do you think about this? Should I go ahead and get my second booster shot, the fourth shot? I said, how long has it been since you've gotten your last shot? And he said, I don't know, Governor, probably 6 months ago. I said, do you realize you're walking around without hardly any coverage or without hardly any immunity right now? Do you really want to do that? No, I'm going tomorrow. I'm going tomorrow if you're telling me that. Well, that's what I've been telling you over and over. If you've gotten your last booster shot and it's 4 months ago, 6 months ago, you need to absolutely dial in. You got to dial in right now and get that other booster shot because you don't have any resistance whatsoever to amount to anything right now. You've got to dial in and get that booster shot. As far as our vaccine numbers, now we're at 90.8% of our 65 and older, keeps on bumping up, 72.1 of 18 and over and everything. It's good. We keep getting there, slow but sure, but we're getting there. The new vaccine calculator up and everything and going. Dr. Marsh, General Hoyer and Western University, so thankful for that calculator that gives us the ability to remind us when we're going to need a shot. A second booster is available, 50 and older. It's all out there and everything. The vaccine info line, is all there for you, and it's up from Monday through Friday from 8 a.m. to 6 p.m. All the free testing still out there and everything. Take advantage if you have any kind of symptom whatsoever. There's 26 outbreaks in our long-term care facilities. There's none in our church community. 9 inmate cases and 6 staff cases. The rental assistance program is still available to renters. It's available to landlords. I had a person call me over the weekend and says, Governor, I've been a renter for a long time, and I've had a lot of trouble and everything. I'm having trouble absolutely with my rent. I'm behind with my rent. I'm having trouble with my utilities and everything. I got a job and everything, but I've had a lot of trouble and everything. But I hear that this rental assistance program or this program is out there, and can it possibly help me? And I said, I really can't imagine that some way, somehow, the news is still not getting to everyone. And I challenge the media, help me, because these people that are still out there that are hurting, they need to know. And I'm trying every way that I possibly can to get that message to them. It goes right along also with homeowners, not just renters and landlords, but also now to homeowners. And with all of that, I tell you over and over and over, this is going to help a life. This is going to help someone. And that is so meaningful, it's off the chart. But in addition to that, it helps all of us. Because if they have additional money, they go spend additional money. And if they spend additional money, it increases our employment. The multiplier effect of those dollars is really significant. So help me get that word out. I could not believe when that gentleman called. And then when I explained it to him, he said, I'm calling tomorrow. I'm going to call tomorrow and see if they, that they can get me qualified. And then that would not only help me, it may very well save my life. From the standpoint of giving blood, I encourage you in every way. From the standpoint of our job jumpstart program and everything, it's working. We're getting people that are tough to get across the finish line and everything back into employment, and they are proud of themselves, and it gives them that feeling and that sense of pride, and it's really just great stuff. That Jumpstart program came from Oklahoma. We copied it, and it's working. I've signed all the bills that came out of the special session and everything, and I think we're moving forward in that regard in every way. We've got an RFP out in regard to to bringing folks in to give us a top to bottom assessment of DHHR and ways that we can make DHHR better. On Friday, I joined a bunch of folks and kids and everything at the military signing day ceremony at James Monroe High School. And it was really good. Really, really, truly good. They were, at the time, I think there was 8 young people that were signing up to go into the military. Now, with all that being said, let me just say just this. Here was the message that I told them. This is exactly how I feel. With all in me, this is exactly how I feel. All of us owe those young people. All of us owe the active military. All of us owe our veterans. We do. We do. They've given us every single thing that we have. We owe them. We owe them all. We owe them all for what we have in this world right today. And absolutely, we should never forget that. So it was a good day at James Monroe, and absolutely, without any question, we owe them. And absolutely, we should be proud of it. On Saturday, I was the commencement speaker at the College of Liberal Arts at Fairmont State University. I enjoyed the day. Believe it or not, they made me an honorary doctorate of humanities, and so all good. And they maybe even made baby dogs some honorary doctorate. I don't know what that was, but nevertheless, a bunch of beautiful young kids and everything that are studying fields from criminal justice to, the teaching areas or the history areas or psychology or all the different languages and how to help and assist people with all the different languages we have. Really a really good day, and what a school. I mean, that's all there is to it. I thank Dr. Martin in every way. She's doing a fabulous job. Every one of those kids, every single one of them, can you imagine this? They ain't lasted a little while, that's for sure. And all the parents and the grandparents and the aunts and uncles, I hope to goodness, that they really, really, really appreciated and loved the day. And I said to them, the seat's going to get a little hard and maybe just, a little hot in there and all that, but really a beautiful day. But anyway, I said, someday you don't know what you'll give to be back in that seat, to be back where it's a little bit hot, maybe a little bit uncomfortable, because it's a moment that you're so proud of, it's unreal. You're seeing, one of your children graduate from college and go on their way. It is true. It was truly an incredible day. But let me just say one thing about Dr. Martin. When the kids came through there, there's an athletic director, Rodney Weichel, that told me a long time ago, kids know if you like them. Well, absolutely. These kids love Dr. Martin. And she stood up, and as she was coming, every single one of them, she would straighten their hair or straighten their robe or straighten whatever on them and everything. She would, absolutely, if they had, something about their hat that was out of alignment and whatever like that, she would get it all right and everything for the camera to take their picture. It took a little while, but it's out of love. And absolutely, I don't know how it gets any better. Fairmont State has gone from 30 graduates, or 30 enrollment rather, in I think 1858 to an enrollment today of 4,200. It is absolutely a beautiful school. They're doing great work. I congratulate them all. I congratulate, all those that are connected in every way. The professors all there and everything. It was really neat. Great day. Great day. So thank you so much. That's all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. As the governor has pointed out, we are seeing a bit of a rise in cases of COVID-19 in West Virginia as well as in the United States. We saw 95,000 cases in the U.S. yesterday, and we know that the BA.2 variant is the dominant variant in the U.S. and in West Virginia. But looking to other countries like South Africa, we see that other strains of the Omicron variant, the BA4 and the BA5 variant, are now dominant there. And each new variant has gained additional opportunities and capabilities to spread faster than the previous variants. And the BA4 and the BA5 variant are able to escape immune detection, even in people that have been previously infected with the initial Omicron variant, the BA1 variant. Now, that's a lot of confusing terminology, perhaps, but I think the important take home here is that COVID continues to mutate and to evolve, and we have to make sure that we are protecting ourselves. And as we said before, COVID is really, really critically targeting our older part of our population. So we know that of the 992,000 deaths now we've seen from COVID-19, around 920,000 deaths, this is in the United States of America, have been in Americans over 50 years old. And as we said last brief, that means that about 1 out of every 125 Americans over 50 has died of COVID-19. So that's the reason why it's so very important for people to get vaccinated, to make sure that your vaccinations are current, and you can use the vaccine calculator for that. And we're seeing from South Africa that the combination of full vaccination plus infection is really, really good to give you sufficient immune protection. But previous infection, particularly with earlier forms of COVID-19, is not giving these South African citizens the kind of protection that they thought they might have, because these new variants are able to escape the immune surveillance even better. And as we go forward, we know in the US, we're about to break 1 million deaths from COVID-19, which would have been unthinkable really at the beginning of the pandemic. And we know that today COVID is a treatable disease that nobody really should die of, or at the very most, a few people. And that's because we have vaccines that are highly effective. We have medications that are highly effective. We just need to make sure that all of our citizens are protecting themselves and protecting each other from this still killer of people, particularly that are older or that are immunocompromised in our country and in our state. Thank you.
All right, thank you, Dr. Marsh. Next, we'll hear from retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just like to highlight a couple of things, reinforce what the governor and Dr. Marsh just pointed out related to West Virginians over the age of 50. We are continuing to work with our long-term care and assisted living facilities through the West Virginia Healthcare Association to educate not just the residents, but the families of those residents, the importance of staying current on vaccines, how important that is. As Dr. Marsh has pointed out previously, over 95% of the West Virginians we've lost are over the age of 50. And if you look at some recent statistics put out nationally, if you are over 50, you have a 1 in 125% chance of dying from COVID. So the governor is continuing to press us to work with these organizations. In addition to that, significant work being done now to push out educational information to our Medicaid population through the MCOs. And we will continue to work those efforts ongoing to make sure that we protect our West Virginians over the age of 50. Thank you.
Thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. Since the inception of the COVID-19 vaccine info line in January of 2021, there have been more than 275,000 phone calls into that line. Calls range from West Virginians seeking information on vaccine locations to general information about COVID-19. The info line operates Monday through Friday from 8 a.m. to 6 p.m. and Saturdays from 9 a.m. to 5 p.m. I believe that number is up on the TV now. It is 833-734-0965. During this pandemic, we have had many who have stepped up to the plate, and we are grateful for their hard work and dedication. A huge thank you to John Lopez and his team from DHHR for handling these important calls. Thank you, John and team.
Thank you, Secretary. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, my question would have been, what are you having for lunch, since we're at the noon hour, but I think I'll bypass that one. You have been pushing the program for homeowners and also for rental assistance. During the pandemic, has there been any federal funding that you've had to send back or refuse because of a lack of interest or a lack of a number of people that would want to participate in the program? Thank you.
Paul, I'm trying to think. You know, the original CARES money, you know, we maxed that out to where we didn't have to send any of that back. One of the big things was a real move towards the nurses, you know, and doing something for nursing, you know, to be able to increase the number of nurses within the state. You know, from the rental assistance program, I've got to think that we'll probably end up having to send some of that money back, and the reason for that is it was primarily written for folks, you know, in big cities like Chicago, D.C., New York, whatever it may be, and where there's a real high number of renters, and you know, it's like all the government programs. It goes to try to one size fits all, and but we've tried to handle this as best we possibly can all the way across everything. But you know, from a standpoint of in West Virginia, I think, you know, that we have a high per capita you know, home ownership in West Virginia, and that's really good. But I do believe we'll end up sending back some of the dollars on the rental assistance program, and I don't want to send them back. You know, I'd rather they stay here in West Virginia and spend money in West Virginia. But Paul, that's the best answer I can give you right now.
All right, thanks, Paul. Next to John Mark Shaver with WV News.
Good afternoon, everybody. I have two questions, if you can indulge me, both for probably Dr. Marsh. Number one, you talked about the cases rising. State hospitalizations have also broken 100 for the first time in a while. How much of that is a concern to see in these numbers creep back up on that front? And also, we've had so many West Virginians sick with COVID, and there's reports coming out about cognitive heart and lung issues for people who've had it, even though they haven't died. What do you think the long-term impact of this virus will be for the state on that front? Thank you.
Dr. Marsh, that's got to be you.
Thank you, Governor, and thank you, John Mark. First of all, we closely watch the number of hospitalizations as part of the foundational mission that the governor has given to all of us. And although we do also note that hospital admissions have increased to about 100, certainly that is still relatively low related to the capacity we have, and likely reflects the impact of the BA2 variant that has continued to grow here in West Virginia as well as the rest of the country. And as we look at national numbers, as I suggested, we have seen a higher increase in the number of cases than the number of hospitalizations and deaths. And that's likely because, number one, we do have more people vaccinated, and as we've said repeatedly, to be current with your vaccinations. And number two, we are also likely seeing the impact of the number of West Virginians and Americans that have been infected. Remember, in December of 2021, the Red Cross demonstrated using blood samples that about 34% of our adult population had evidence of antibodies to COVID-19, which doesn't mean that they're actively immune, but it means that they've been infected before. And in April of 2022, that number went up to 60% of adults in America and 75% of the children. So we saw a great number of people infected likely during that interval between December and April. And that immune function, particularly with the BA.2 variant, does benefit and also works to reduce the severity of the illness. When we look at the issues of long COVID, which was your second question, that is something that we all should be really concerned about. And it turns out that even people who've had mild cases of COVID and gotten over it, that according to some studies, between 10 and 30% of those people can have long-term consequences of COVID-19, including feeling very fatigued, feeling short of breath, having lung or heart problems, having brain fog. And that number goes up as people are more severely ill with COVID and have been hospitalized and in the ICU. And as a prevention measure, we know that full vaccination reduces your risk of long COVID by at least 50% in many studies. And even in people that have developed long COVID, getting your immunizations up to date has improved symptoms in a number of people. So getting vaccinated is really important, not only to prevent the most severe consequences of COVID-19 and to prevent deaths, but also to help reduce the likelihood of long-term COVID symptoms in people who do get infected. Thank you.
All right, thank you, John. Mark, Governor, I'll turn it back to you.
Okay, well, let me just review real quick, okay? And then let me ask a favor. Dr. Marsh just said to us that COVID is a treatable disease. You know, we should really pay real close attention. COVID is a treatable disease. Now, we are going to lose maybe a few people, but in every single thing, whether it be the flu or whatever it may be, we lose a few people every year. COVID is a treatable disease. The vaccines are incredibly safe. That's exactly what he just said. And absolutely, the vaccines can prevent us from having people die. He said, really, almost no one should die. You know, and so with all that, please take that to heart. General Hoyer echoed to us the fact that of our 50 and olders in our state, in our nation, 1 in every 125 of them have died. Well, I mean, if that doesn't alarm you if you're over 50, I don't know what does. You've got to get your shots, and you've got to for sure get your booster shot. The last thing I'd tell you is just this. In the state of West Virginia, there is a real power in people feeling good. You know, a long time ago, I really believe that the gift that Ronald Reagan gave us at a time when the previous president, Jimmy Carter, was in office, we had runaway inflation, runaway interest rates, you know, gas lines, 100 hostages in Iran, over and over and over. Everything from a, boycott of the Olympics to a Russian embargo on grain. It was just everything in the world was really upside down. The Soviet Union was running rampant at the time. Something that is close to what is going on today in Ukraine, but they were way, way, way more powerful then. The Soviet Union was absolutely in charge of many areas of the entire globe. You know, with that being said, then along came Ronald Reagan. The American people felt, under Jimmy Carter, they felt maybe beat down. So maybe in a lot of ways, kind of like West Virginians have felt for decades and decades and decades. And now, absolutely, I believe the gift that Ronald Reagan gave to the American people was he made us feel good about who we are and turned us loose. And I hope in a lot of ways that I've done the same thing for the people of West Virginia. But really and truly, we feel better today. And there's a real power in that feeling good and being proud of our accomplishments and what we're doing. I hope to goodness that someone in the media writes and puts on the headlines of their papers and everything that we are approaching $1 billion surplus in 10 months of this year. I hope to goodness that somebody prints $993 million ahead, and that be the headlines that catches everybody's eye. I don't care if they mention my name at all. But truly, and I believe this, I believe when we feel better, when we're more proud of who we are in West Virginia, when we're more proud, and we absolutely repel in every way the Bette Midlers and all the people that are the naysayers that are still trying to beat us down, it will make us more powerful and it will make us better. It will bring more goodness to who we are. So I ask really and truly that you help me. We have had something happen today that is unbelievable by anything we could possibly measure it with. $253 million surplus in the month of April, in 1 month. $993 million year to date. Could there possibly be news that is absolutely bigger than that for the people of West Virginia today? Now, I absolutely hope that we will absolutely echo that through every hollow and every mountain all across this state, and we will only feel better. And as we feel better as West Virginians, we'll make more and more and more goodness happen to more West Virginians. So absolutely, I congratulate you all, West Virginia, and I thank the media for all the good that they do all the time. And absolutely, I believe with all my soul that we are really on a heck of a ride, and we absolutely have many, many, many more good things to come. Nothing on this earth could make me more proud. It's been a real honor. So thank you so very much. That's all I got.